this is Dr. Shepard, and what I'd like to talk to you right now about is the saphenous nerve. The saphenous nerve is clinically important because it can mimic both medial shin splints and it can cause medial knee pain. Now the saphenous nerve is actually a branch off the femoral nerve. So to talk a little about the femoral nerve comes out your L2, L3, and L4 nerve roots. It runs parallel to your hip flexors. In about mid-portion of the mid-thigh, it will actually split off, and that's where the saphenous nerve originates. The saphenous nerve will actually travel down the adductor canal, and as it comes out, it will pierce both the gracilis muscle and your sartorius muscle. A portion of that nerve will actually supply the anterior sensory portion of the knee. The rest of it will supply the lower portion of the leg. Now, to talk a little bit about the exercise to relieve that pain, is very simple. It's something called a nerve floss. And if you watched any of my other videos, you saw that we're going to use the nerve to treat the nerve and to basically alleviate some of the pain. So to first do that, what we're going to do is we're going to make sure our foot's against a wall, a stair, or a door, something that's very sturdy, and we're going to make sure our foot's basically pushing against the wall. What we're going to do with our other leg is make sure it's facing forward. We're then going to lock the knee out, and all we're going to do is then glide and put all our pressure on this knee. And then we're just going to glide back. You're going to hold that for about 1 to 2 seconds, and then we're going to come back. Now, because the saphenous nerve is a portion of the femoral nerve, we want to also get a portion of the femoral nerve and floss that as well. Carol Levitt said, if you look only to the side of pain, then you're lost. We want to look at both the whole kinetic chain. We don't want to just look at just the saphenous nerve. That's why we want to include the femoral nerve, because that's where the nerve actually originates. So to get that portion of the nerve, what we're going to do is we're actually just going to keep the same foot position, same leg, keep the leg locked. Everything's going to be the same, except what we're going to do is tilt our head back, and as we glide, we're going to tilt our head back, and then we're going to bring our arm over. And that's going to get the femoral nerve. So we're going to hold that for 1 or 2 seconds. We're going to reach again, and then we're going to do that. Now you're going to want to perform that about 5 times throughout, and then throughout the day you're going to do about 3 or 4 sets of 5. Now if you have any questions, you leave a comment right below this video, or you can email me at drshepard@bnchiro.com.